Hello there, very good evening and a warm welcome to the news live on Channel I Rupavahini. I'm Sharon Mascrenius.
A very good evening indeed. I'm Charity Prarachi, and now let's move on to the headlines for tonight's news.
Another coronavirus patient dies. The number of infected persons increases to 122. The curfew is to continue in districts under threat. In other districts, the curfew will continue till the 1st of next month. The Mahanayaka Theras request blessings on the general public from the 1st to the 7th of April. The telephone of the Public Relations Division of the President's Office remain open 24 hours of the day. Many financial contributions to the COVID-19 Health and Social Insurance Fund. The US President says that the highest death rate from coronavirus is likely within the next 2 weeks.
On to those and other stories in detail now, and starting off with local stories. The Mahasangha, headed by the Mahanayaka Theras of the three Nikayas, request the general public to engage in blessings for the people from the 1st to the 7th of next month. The Mahasangha also informs the people to take part in the Meritorious Act from 7 p.m. to 8 p.m. on each day. The Mahasangha in a communique says they deeply grieved over the chaotic situation that have arisen due to the spread of coronavirus. They further says that they appreciate the benevolent nature of the Sri Lankan people who provide alms to Mahasangha. The Mahasangha further points out that they should also make a special commitment on behalf of the people who had looked after the Mahasangha for a period of nearly 2,500 years. The Mahasangha further informs that all temples in the island will engage in ringing of bells and engage in Panchasila and Buddhavandana programs for 7 days starting from the 1st of next month. Thereafter, chanting of the Ratana Sutra and Girimananda Sutras will take place to bless the countrymen and people of the world.
Meanwhile, the Anunayaka Theras of the Malvatta and Askiriya chapters say that all citizens of the country must extend their support to the program being carried out by the government and the health divisions to eliminate the coronavirus. They made these remarks extending a special statement to the national television. Anunayaka of the Malvatta chapter, Niyangoda Vijitasiri Thera, said that they should complete the process within a short period. The problem has been aggravated due to wrong behavior of the general public based on luxurious living.
විශාල වගකීමක් තියෙනවා. ඒ වගකීම මහජනතාව ඉෂ්ට කරන්නට ඕන කියන එක මේ වෙලාවේ අවබෝධ කරගන්නට ඕන.
දැන් තමන්ගේ අවශ්‍යතා
Anunayaka of the Askiriya chapter, the Venerable Anamadwe Dhammadasi Thera, said that a severe problem would create if engaged in wrong policies. People should be civilized and they should always think of the common
තමන්
needs.
ගැන හිතනවා වගේ පොදුවේ රට ගැන හිතන්නට අනුන් ගැනත් හිතන්නට මේවා අර්ථවත් වෙන්න නම් දැන.
Meanwhile, the Presidential Media Division says that the deciding on naming and selection of isolated areas as well as imposition of curfew in areas are being taken at the highest government level. The relevant decisions are being taken upon analysis of all pertinent data. In the event of any need to create any change in the curfew being implemented in any area, all relevant information should have to be directed to the Presidential Task Force established to control the spread of the coronavirus. The Presidential Media Division, issuing a communique, reiterates that no decision should be taken under any circumstance on the regional level that would cause inconvenience to the general public. The relevant staff provides instant solutions to many of the problems. The problems which could not be resolved by the Public Complaints Division will be summarized and handed over to the President. The solutions based on policy decisions are being taken by the President's Secretary according to the instructions of the President. Complaints regarding any activities not complying to government orders or engaging in any activities that would put the general public into difficulties should be made to telephone numbers 0114 354 550 or 0114 435 655. Those who are unable to contact the relevant authorities through these numbers should contact them through the numbers on 0112 354 354 and also through extensions 3872, 3873, 3874 or 3875. The telephone numbers 0112-860-003 or 0112-860-004 remain open for presentation of information relating to spread of COVID-19 disease. The general public is also being informed that they could provide information also through the extension of 3355 of the telephone number 0112-354-354.
ආගමන විගමන පාලකවරයා විසින් ලබාගෙන තිබෙනවා අප්‍රේල් 1 වෙනිදා දහවල් 12ට පෙර ඔබ ඇතුළත් වුණේ නැත්නම් අපි මේ නාම ලේඛනයේ තියෙන නම් සහ ලිපිනයන් සංසන්දනය කරමින් එවැනි පුද්ගලයන් පදිච්චි ස්ථාන වැටලීමට බලාපොරොත්තු වෙනවා ඔවුන් අත්අඩංගුවට ගැනීමට ක්‍රියා කරනු ලබනවා ඒ වගේම නිරෝධායන රීතීන් වලට පටහැනිව කටයුතු කිරීම සම්බන්ධයෙන් ඔවුන් රක්ෂිත බන්ධනාගාරගත කිරීමට සිදු වෙනවා.
Meanwhile, the number of confirmed COVID-19 cases worldwide has reached to 735,345 and the death toll from the disease has reached to 34,818 as the pandemic has spread in 202 countries and regions globally. According to the latest figures from the World Health Organization, that is, US President Donald Trump extended his stay-at-home guidelines until the end of April, dropping a hotly criticized plan to get the economy up and running by mid-April after a top medical advisor said more than 100,000 Americans could die from the coronavirus outbreak. The reversal by Trump, which he said would be disclosed in greater detail tomorrow, came as the U.S. death toll topped to 2,419 from the respiratory disease, with more than 142,000 cases, the most of any country in the world. The COVID-19 outbreak continued to ravage Europe, with the death toll in the region climbing to over 21,000 out of more than 360,000 confirmed cases. Many countries have expanded stockpile of medical materials and continue to strengthen prevention and control measures. The pandemic had claimed 10,779 lives in lockdown Italy by yesterday, with the cumulative total infections reaching to 97,689. A total of 756 COVID-19 patients died over the last 24 hours, the second consecutive fall in the death toll after reaching an all-time high on Friday. Spain saw the highest single-day fatalities from COVID-19, with 838 deaths recorded yesterday. The total death tally has increased to 7,340, with 537 deaths occurred in the past 24 hours. Meanwhile, the country detected 5,085 new COVID-19 patients, pushing the total number of confirmed cases to 85,195. The coronavirus outbreak has infected 2,599 more people and killed 292 others in France. A total of 40,174 positive cases were confirmed, of which 2,606 died, while a total of 7,132 infected people have recovered since the virus has been spotted in the country. Japan's health ministry and local government said on Sunday that the total number of COVID-19 infections in Japan has risen to 1,866. The death toll in Japan currently stands at a total of 64 people, including 10 from the virus-hit Diamond Princess cruise ship. In Colombia, the number of confirmed cases increased to 702 as of last morning, with 10 deaths. This is just news just in that we are bringing to you. The President's Media Division informs that a special relief package financially as well as for policies has been informed to the general public. As for the benefits for the people, a full detailed description will be provided to you in the news as we come along. But for the moment, the President's Media Division, the President's Office informs that a special relief package in view of the current situation which is prevailing to the COVID-19 has been provided financially and in terms of the policies as well. Stay tuned with Rupavahini News as we bring you more on this update. And a short while ago, we brought you breaking news from the Presidential Media Division, and here's the update for you. Many other financial and material reliefs for the affected persons owing to the coronavirus pandemic in the country. According to the circular issued by the President's Secretary, the persons qualified for the reliefs are allowances worth 5,000 rupees for 416,764 elderly beneficiaries and 142,345 listed persons identified as elders. Meanwhile, 84,071 differently able allowance beneficiaries and 35,229 listed persons identified as differently able. 160,675 registered farmers under the Agrarian Insurance Scheme will also be benefited. Meanwhile, 25,320 beneficiaries who are patients with kidney diseases and 13,850 listed persons identified as patients with kidney diseases, as well as direct supply of nutritious rations for pregnant mothers and malnutritious children, 5,000 rupees worth allowance for 1,798,655 Samurti beneficiaries and 600,339 listed persons identified as Samurti beneficiaries as well. Payment of pension for 645,179 retired state employees. Payment of salary for the month of April for 1,500,000 state employees, and the debt repayment based on the salary has been suspended until further notice. Relief will be provided for the leasing payment of 1,500,000 persons engaged in self-employment using vehicles including three-wheelers, school buses and trucks as well. Relief will be provided for the private sector to pay salaries of their employees.